Flu numbers in our area this season are much lower than they were this time last year.
But the Centers for Disease Control and Prevention says that's expected to change, and not for the better. Nicholas Qualick joins us now with more.
So far, Wichita County Health District officials say out of the 7,000 samples taken from patients showing symptoms statewide, 27% tested positive for the flu. And at United Regional, they've reported only 24 confirmed cases of the flu for December. Keeping in mind, this compares with the 300 positive flu cases this time the previous December. But high or low, health officials say it's not too late to take preventative action to keep those numbers as low as possible.
The CDC is saying this is actually going to surpass last year. It hit a lot faster, so I expect this to be a really long season.
Patricia Ackley has seen her number of flu seasons in the medical field over her 15 years. She says right now, numbers alone would suggest a slower and less impactful flu season. But Ackley says those numbers don't represent the whole picture.
The big problem in that is every person that you see, think of the number of people that do not come. So they've got the cough, they've got the runny nose, they think they have a cold, but they don't think I have the flu.
And then, Ackley says, they often try to lead their lives as normal, most likely infecting others, which causes the flu to spread quickly. She says you don't need to have a high fever to be screened for the flu. Instead, you should be screened if you have flu-like illnesses. She says she can't emphasize enough the importance of getting a flu shot, and not just because it's her job.
There are more people that die of the flu every year than women that have breast cancer. You do not want to be one of those people that could have prevented the illness. So I think you just need to reach out and get it done.
The two groups needing a two-phase vaccination include seniors as well as children above 6 months that have never been vaccinated. They need to have that done in the same year. That's, of course, after consultation with a physician.
Nick, thank you so much for this report. And we have the latest from the CDC inside the story over on Texomashomepage.com.
The CDC has now confirmed the nasal flu vaccine was less effective among children in recent flu seasons. Experts did not recommend flu mist during the past two flu seasons because of concerns it offered less protection against H1N1. And also data from 2013 to 2016 shows flu mist was only 20% effective against influenza A and H1N1. The flu shot was 67% effective.